Okay, hi guys, welcome to the Introduction to Dispensing lecture. So this is the first part of 2 screencasts. Okay, so in this lecture we're going to be building on from what you started in last term, where we were starting to look at how to sort of screen the different prescriptions. And this term you'll be learning how to dispense and label the prescriptions, and also starting to learn how to counsel patients. So for this screencast, the overall aim is to go through the essential components of the dispensing process. So the things you should be able to do is list the legal and good practice requirements on a dispensing label. You should be able to outline the requirements for manufacturer's labeling, providing a safe dispensing process, which will include handling of cytotoxic medicines, and also being able to describe the use of common packaging. Okay, so when we talk about dispensing, I think I started to mention this last time as well. Dispensing is the whole process. So from the point we take the prescription from the patient to supplying them with the medicine. So the supplying of that dispensed product. So it's the process from the start to when you actually give the product out to the patient, and that whole process is called dispensing. So I think this is a good way to summarize what dispensing is. So it's we can think of it as being getting the right medicine to the right patient at the right time. Okay, so as a top level sort of overview of the dispensing process, these are the basic sort of steps which you'll be going through. So we'll conduct a professional or clinical assessment of the prescription. And we spoke about this in the Introduction to Prescriptions lecture last term. So this includes stuff like making sure the doctor has signed the prescription. And actually you'll be surprised how many times this does happen. You'll be checking if the prescription is still in date. So remember, most types of the normal sort of FP10s are valid for 6 months. And you also need to consider if the prescription is safe for that particular patient. Does it interact with something else on their past medical record? So any other medication they might be taking? Are they allergic to it? And is the dose actually appropriate? So then you'll go ahead and label the prescription. You'll assemble it. You will then conduct an accuracy check to make sure it is dispensed and labeled correctly. So you'll need to do both steps in the dispensing classes. Normally, obviously, in clinical practice in pharmacies, you might be doing this in a two-step stage, or you might have other people accuracy checking for you as well. But here you'll be doing both the accuracy and the professional clinical check as well. And then you will hand to the patient. So you'll make sure they have been given any counselling they might require, and also so they understand how to use the medicine in a safe way. Okay, so first thing to think about when we are dispensing is making sure that we are in a safe environment for that process. So that means keeping our environment clean and tidy, so keeping it well organized, and this makes sure it's to make sure it is safe and minimize the risk of any sort of contamination to the product, and to avoid mixing products. So either in one for that same patient, or even between different patients. So if you have different patients going on at the same time and there's a lot of clutter, there's a chance that the medication might get mixed up. So if you think about when you go into the pharmacy, you would expect the team to be wearing smart clothes. So either business dress or a clean white coat. So back in the day, pharmacists used to wear sort of lab coats. Occasionally, people still do, but mostly now everyone wears business dress. So for your dispensing classes this term, we'll be expecting you to attend in business dress, so the type of clothes you would wear when going into work in a pharmacy. Well, we recommend that when working in a pharmacy, not having your phone on you, as it increases the chance of distractions. So again, when coming in for your PAMS classes, you'll need to make sure phones are switched off and away in bags. So they shouldn't be on your desks, the phones. Okay, so we've put together a series of standard operating procedures, so more commonly known as SOPs. And again, we touched on this last term. So you'll be aware that all pharmacies have a set of these SOPs, and normally a pharmacy has a lot of them. We've prepared our own. We've tried to keep it simple, so we've got 4 SOPs for you to read. So the first one is outlining how to assess a prescription. So to do your professional clinical assessment like we did last term. The second one is on how to label. The third is assembling the prescription. And the fourth one is how to accuracy check a prescription. So you need to have a read of these SOPs and ideally before you come into your sessions, and you can find these in this lecture folder. So really important that you read all 4 SOPs. Okay, so the next thing I'll be talking about is the manufacturer's labeling requirements. So it's slightly different from the labeling requirements that you need to adhere to when you're dispensing products, and you need to. It's important to be aware of the differences. So if we look at the best practice guidance, which is produced by the Medicines and Healthcare Products Regulatory Agency, so the MHRA, then they will say that the primary purpose of medicine labeling and packaging is to make sure that the information is very clear about how the medicine should be used and its identification. So there's a link to this guidance document in the lecture folder if you wanted to have a look at it in more detail. Okay, so the primary purpose of medicines labeling and packaging is the clear, unambiguous identification of the medicine and the condition for its safe use. So some of the common factors affecting all users of medicines can be summarized under 3 headings. So the first one is information, which is obviously important to make sure that our patients are able to use their medicine safely. And so we need to ensure they have all the required medicine-related information. The second is format. So this is making sure that the information is eligible and it's easy to read, easy to understand, and that's for everyone involved in the supply and use of medicine. So that includes pharmacy staff, it includes the patients, and any carers that might be involved as well. And the final one is style. So this is the way that information is presented in terms of the font, the way the packaging looks. So you may have seen that there have been sort of some issues with dispensing errors, and that might be because of a similarity in drug names or in the packaging. So style is very important as well. So if we start with thinking about the first one, so information. So the information that is considered critical for the safe use of medicine, okay? So which information? So the first one is the name of the medicine, okay? So the actual drug name, sometimes it's brand name, so it needs to be very clear. The second is the expression of strength. So how many milligrams, how many micrograms or units there are within that dosage unit. And then the route of administration as well. So is it oral, topical like a cream? Is it intravenous, like an injection? And then you've got dosage information. So how does the patient actually need to take it, or how do they need to use it? And then you also need warnings. So any warnings that are relevant to the medicine and its use. Okay, so that's the information bit. And then if we think about the format of that information, that's on the label. So if we're starting to think about the name of the medicine, it's required to be on 3 non-opposing sides of the box. So ideally, wherever the patient is looking, they should be able to see the name. There should also be a print of the medicine name in Braille, and that can be on the front or back, and it's for those patients who have impaired sight. So it's really, really important that you don't cover this Braille with your dispensing label. They require that the critical information, so the important information, should be kept together. So the patient shouldn't need to look all over the pack, and it should be located together and ideally in the same field of view. So all the information can be seen at the same time. So this is normally on the back of the pack. And then sort of also the information hierarchy is important. So the most important information should be located in the most prominent position compared to the information that is less important. Okay, so similar drug names and similar packaging increase the risk of dispensing errors. So thinking about the style of the packaging, so if you look at the example on this slide here, it's an example of where packaging looks very similar and it can lead to errors. So all 3 packs are very similar in color. So the one in the middle is allopernal and left and right are amlodipine. And actually, so the amlodipine is slightly different colors, whereas the amlodipine 5 mg and allopernal are the same color. And also the drug names are of similar length and both start with an A. So if you weren't paying enough attention, you could easily make an error when dispensing one of these, or even if the patient was sort of taking both of them together on the same prescription, they could easily mix them up. So this is something really to be aware of. In the pharmacy, you try to store sort of similar looking packaging away from each other to avoid them getting mixed up. So any sort of common errors previously made by the pharmacy or by particular staff, you then try and do something about it and move the actual packaging away from each other so the mistake can't be made again. So the other thing we can think about is when drugs have similar names, they can also lead to dispensing errors. So a common example is the cephalosporins. So I've listed the drugs here where the front is similar and they even end with the same letters, and it's only the middle bit that is different. So to try and reduce errors happening with these type of drugs, the MHRA and the NPSA, so that's the National Patient Safety Agency, they brought in this new special font called Tallman. So Tallman is where you use capital letters to identify the actual differences. So on this slide, the bits in red are in capital letters, and that's to try and show the difference in drug name. So sometimes you will see Tallman font, this type of style used on software, or even sometimes on prescriptions to help avoid errors being made. So as I mentioned, this is the information available on the MHRA guidance document, and there's a link to this also in this lecture folder. Okay, so when we come to think about the actual dispensed item, this is where you will come to dispense the actual product. Things are slightly different. So here on the slide there is an example label. It's for simvastatin tablets. So it shows that it has been dispensed by the University of Reading. And the bits in red are legal requirements. So legally we need the supplier's name and address. So that's the pharmacy which is making the supply. So in this case, the University of Reading. We need to have the drug name. We need to have the cautionary and advisory labels, the patient name, and have the date the product was dispensed, and the directions for the patient on how much to take. We also need to have the words keep out of reach, and this is printed automatically on the labels. And then for good practice and if appropriate for certain medicines, you need to have the word external use only on this label as well. The other bits we will usually include is quantity, so we know how many have been dispensed, and then the form and strength of the drug too. So when we come to labeling, within the School of Pharmacy we have our own specific way we want you to label your products, and these are called gold standard labels. So there's a copy of this on Blackboard, and I strongly recommend you understand this or remember this. The gold standard labels, as this will form sort of the basis of all the dispensing assessments that you're going to have during your course here over the 4 years. So it's really, really important that the patient understands from the label on how to take their medicine. So is it take? Are you using the words give, apply, or insert? And then how many do they need to take? And when? So that's how many times a day and at what times, as well as knowing what the quantity is. So when we are talking about how, we want you to use the active voice. So the examples on the slide are in the active voice. So take, give, apply, insert. We don't want you to use the passive voice. So the example of passive voice would be one to be taken. And that's because there is evidence to show that people are more likely to understand when the active voice is used. So we say take one tablet rather than one tablet to be taken. Okay, so really important that you understand the gold standard labels, because that makes it much easier for patients to understand, and it's easy to read as well. And some medication needs a duration given too. So for example, like some antibiotics will need a specific course, which has been already stated by the prescriber on the prescription. So we want to ensure that is on the label for the patient to read. So for example, steroids like corticosteroid, they have specific days as well. So it needs to be clear to the patient on how long they should be taking it, and not to stop a few days before, but also not to carry on taking it beyond the actual recommended treatment. So the other thing to bear in mind is if the patient will be able to read the font. So some dispensing programs will allow us to label in large font, and that helps patients who are visually impaired. So there are a few examples I've put on the screen there to show the types of things you will be labeling over the coming years. But as I said, if you have a look at the gold standard labels, it'll be a lot easier for you to understand, and you'll be allowed to use the gold standard label sheet in sessions as well. So print it out, bring it in with you. But if you look at the slide here, you've got such a wide variety of examples. So eye drops, inhalers, suppositories, injections. So, and each different form has a different way of labeling. So as well as making sure you have the right information on the label, we need to make sure that the recommended cautionary and advisory labels are also on there. And these can be found in Appendix 3 in the BNF, also on the back inside page as well. So here, for example, paracetamol tablets, we need label 29 and 30. So 29 is the patient should not take more than 2 at a time, and they shouldn't have more than 8 in a day. And then warning 30, it reminds the patient that this is a paracetamol product, and they should not take with other products containing paracetamol, stuff like Lemsip. And there is also a recommendation to speak to their doctor if they take too many of their tablet because of the high risk of overdose. Okay, so remember, warning labels are found on Appendix 3 or on the inside back page. So these are information that needs to be on the label when you print out and stick on your product. So those are sort of the main points about labeling. And now that you've listened to that, I want you to have a think about how or what you would put on a label for these two products. So we've got ibuprofen tablets and trimethoprim tablets. You've got the abbreviations there, so try and remember what they mean from last term. So PRN, BD, and then write down how you would label this. So use your BNFs. On this occasion, you can use your paper or online, but try and get used to the paper BNF, and you'll find the cautionary labels in there as well. And once you've had a go, and then come back and listen to part 2, and there I'll talk about how to sort of select the right product and to make sure you've got the correct packaging. So please, if you can have a go at those two labels on how you would write those. Excellent. So I will meet you for part 2.